All right, today we're gonna do a axillary block as well as an adductor canal block. I have Case with me and Brittany. The time is
11:29.
11:29. That's 15 minutes from when I got the text. First off, I will assess the patient. I will check the labs, history, do a chart review, check what medication she's on and her past medical history, as well as allergies. We're going to go through the risks, benefits, and alternatives, as well as contraindications of doing these blocks. The benefit is better pain control, less opiates, less nausea, vomiting, and you also can get some better blood flow to the surgical site when you do the axillary block. We're going to do a surgical block for the axillary block. The contraindications, absolute, would be refusal, relative or infections, coagulopathy, allergy to the anesthetic. We'd make sure that she has no neurodeficits before and chart that. And then the alternatives would be to give IV sedation. For the axillary block, the indication is surgery below the elbow. She's going to have surgery on her wrist. There is also some increase for LAST. And we're going to decrease that risk by aspirating before we inject and using ultrasound guidance as well as peripheral nerve stimulator. This is a shallow, easy to access nerve, so it should be good axillary block. Before I do the ultrasound, we will locate the axillary artery as well as the radial nerve, the medial nerve, and the ulnar and musculateous nerve. The patient understands the risk, benefits, alternatives, and contraindications to the procedure and has signed consent. We're going to give her some IV sedation. I'm going to put her on a monitor, blood pressure cuff, telemetry, pulse ox. I'm going to grab my ultrasound as well as my peripheral nerve stimulator. She has an IV. We gave her some medication for sedation, which will be we'll give her 50 mics of fentanyl and 2 milligrams of Versed, and if she has more pain, we can give her an additional 50 mics of fentanyl. So she's set up to the monitor. I have my equipment. I've gathered my needle, which will be a little bit longer. And I have my assistants. I am going to sterilely prep her with chlorhexidine. I'm going to let that dry for a couple minutes. I'm going to put on sterile gloves in a sterile fashion. I'm going to put on my sterile drape. I prepped her with chlorhexidine. It's dried. The drape is on. I'm going to ask her to be supine with her arm in a 90-degree position so I can access the axilla. I am sterile. The patient's sterile. I'm going to ask Case to give me the ultrasound. And then sterilely place some gel on her axilla. The gel's right here. And for this procedure, we have drawn up 0.5% bupivacaine, since we're going to do a surgical block. And I will give no more than about 20 to 25 milliliters. The max dose is 210 milligrams or 42 milliliters. And I'm going to inject about 6 to 7 milliliters per nerve. So I'm going to put the ultrasound high at the crease. And locate the axillary artery. I went this way. All right, so there you can see the axillary artery, and Case might zoom in on this before he gives me the peripheral nerve stimulator so you can see it. Now, if you can see it, you've got a good view of the axillary artery right here that's pulsatile. Under it, you'll have the triceps brachii, and then you have the musculocutaneous muscle here, and then the corbrobrachialis muscle here. You can see the musculocutaneous nerve in the corbrobrachialis muscle. You can see the axillary artery. Superior to the axillary artery should be the medial nerve. And then here should be the ulnar nerve, and inferior to the axillary artery, you should see the radial nerve. Now that I've identified the landmarks on the ultrasound, I'm going to ask Case to sterilely give me the needle. We will connect the needle in a sterile fashion to the medication tubing, as well as to the peripheral nerve stimulator. For this, we will want to stimulate a thumb twitch. So we're going to place the patch on her hand, on her wrist. And if Case wants to turn on the peripheral nerve stimulator. So under ultrasound guidance, I will go in at a posterior to anterior approach. This is going to be under ultrasound guidance and peripheral nerve stimulation. I can see the axillary artery on the ultrasound. If I stimulate a thumb twitch under 0.2 milliamps, that means I am too close to the nerve. I would pull back. I want to be between 0.2 and 0.4 milliamps, but my goal will be about 0.5. If Case feels resistance, I'm going to pull out just a little bit. He is going to inject medication when I tell him to. Before he injects, he's going to aspirate to make sure there's no blood and make sure that we're decreasing the risks of lasts. I will insert the needle and I will inject the local anesthetic into the radial nerve first, the ulnar nerve second, and then the musculocutaneous nerve third. Medial nerve third, sorry. And after I have injected the radial, then the ulnar, then the medial, since it's a surgical block, I will also inject local anesthetic in the muscular cutaneous nerve that is, we can see on ultrasound in the muscular cutaneous muscle. I will inject about 6 to 7 milliliters per nerve, and I will make sure that I have good peripheral nerve stimulation measurements, around 0.5 milliamps per nerve. However, the local anesthetic may spread, so I may not get as good of readings with the peripheral nerve stimulator. After I have injected the local anesthetic and ensured that I picked off the radial, ulnar, medial, and then musculocutaneous nerve using about 6 to 7 milliliters per nerve, no more than about 20 to 25 milliliters. I will then place a dressing on, make sure there's no bleeding, and ensure that I have good effect of the local anesthetic. I'm going to take a picture of the ultrasound. I will also chart and document vital signs as well as patient comfort and the effect of the block.